You're listening to a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 20 years, please visit www.aapcho.org. Building Sustainable Healthcare Homes is a new podcast series showcasing AAPCHO's Cultivating Traditions of Wellness 2010 Conference and Gala on February 23, 2010 in Washington, D.C.
In this episode, Dr. Thomas Tsang, former Chief Medical Officer of the Charles B. Wang Community Health Center in New York City, first talks about his experiences developing healthcare legislation in the House of Representatives as a former Robert Wood Johnson Health Policy Fellow. He then highlights the important role of community health centers in defining the concept of the patient-centered medical home, or PCMH, and in chronic care management, including the management of chronic hepatitis.
Good afternoon. It's nice to be back with the Community Health Center world. And I can tell you that in the room of 100 Hill staffers that are writing these billions and billions of legislation between the House and the Senate, only two of us are API descent physicians, and both of us came from the Community Health Center world. So it's really interesting to see the other Hill staffers, bright, brilliant people, but they've had no experience in taking care of patients. And these are the people who help decide or inform Congress members making policies that's going to decide funding. With that being said, I'm talking a little bit about building sustainable health homes for the future. I'm going to talk a little bit about the background and a little bit about the hepatitis B situation. So this is the background. 125 million people live with one or more chronic illness, and there's been a lot of attention being paid on policies regarding chronic care management. We spent $2.6 trillion on healthcare, and 80% of it is spent on management of chronic illnesses. Commonwealth Fund did a 2007 survey, and they found that patients identified with the medical home have much better outcomes. The patient-centered medical home emphasizes enhanced care through communication between patients, physicians, and staff. It's interesting to see that we don't really have a real good national standard on what a PCMH is. And so far, best we have is the NCQA definition, and I'll talk a little bit more about that later on. So what's happened legislatively? On the Senate side, it was embedded within their Center for Innovation, and they assigned about $30 billion into it. On the House side, I was fortunate enough to work on this piece of legislation with Steve Cha from Energy and Commerce, and the way we looked at it was there's this NCQA definition, but it's had a lot of these criticisms of being very, very high-tech and low-touch. So what we did was we created two tracks, the independent patient-centered medical home model and a community-based medical home model. And the independent model was really trying to conform to the original NCQA model. But the community-based model, what we had in mind was to allow community health centers to actually apply for some of the funding and serve as care managers for the rest of the community. So it's a way for CHCs to be part of state initiatives. One of the critical things is that you need to take an active role in how to define what the medical home is and how are we going to measure your performance as a medical home. So now I'm switching gears to hepatitis B. Here are some of the challenges: the lack of insurance or non-continuous coverage, the language and cultural barriers, and then the poor comprehension of the disease state. So the IOM finally recognized the disease and see that there's a real need for change. What does the IOM recommend? And this is again from their report. Health Disparities Collaborative could include the viral hepatitis service. The UDS could be modified to track viral hepatitis services. And lastly, HRSA should provide adequate resources to FQHC for providing comprehensive viral hepatitis services. So how we start building a B-centric health home? We need to activate and inform our patients, and then we need to have a multidisciplinary team approach. Everyone wants to run a medical home. Which model is best? I think that's an unanswered question. There's not enough data. But I think it's your job to engage them. I think NAC, NCQA, HRSA, AFP, ACP, APA, the states, everyone needs to sit down and have a chat about what's the best model for CHCs. It may not be the NCQA model. And then lastly, Ken Thorpe is a policy advocate that was advocating the community team in terms of special initiatives to actually do the case management. Perhaps CHCs could be these community care teams. Thank you.
This podcast was brought to you by AAPCHO. Please join the conversation on our Facebook fan page at facebook.apcho.org and tune in for our next podcast at www.aapcho.org.